Welcome to my presentation on human immunity. To begin with, an infection is an invasion of microorganisms into the body which aren't usually there. Some infections can be difficult to identify because not all cause symptoms. Sometimes infections affect only the region in which they enter the body. Other times they multiply and affect the whole body. There are four main causes of infectious diseases: bacteria, viruses, fungi, and parasites. There are also four ways which the infections are transmitted. This is through direct contact, meaning through person-to-person contact, animal-to-person contact, or mother-to-unborn child contact. The second way is through indirect contact, which occurs when an infected person touches or sneezes on an inanimate object which another person later touches. The third way that infection is transmitted is through insect bites. The insect is known as the vector, which passes the infection along. The final way is through contamination. Bacteria such as E. coli spread from food such as undercooked meats and unwashed salads. The body has three lines of defence, two non-specific and one specific. Firstly, the non-specific are those which demonstrate the same response to all pathogens regardless of what they are. They are present from birth. The first line of defence is the use of physical and chemical barriers to prevent the pathogen from entering the body. The skin is the main physical barrier to infections. It is effective as it is made up of the epidermis, dermis, and hypodermis, the three major layers of the skin. The epidermis is the outer layer of the skin and provides the initial protection against the outside environment. The layer of skin is consistently replacing itself and producing new skin for protection. The epidermis is essential for inhibiting water loss, preventing penetration of microbes, chemical irritants and toxins, and is also essential for absorbing and blocking solar and ionised radiation. The dermis is beneath the epidermis and contains connective tissue, hair follicles and sweat glands. The final layer, the hypodermis, is made up of fat and connective tissues. Other defences include mucous membranes in the surface of the eyes, ears, nose, sinuses, mouth and throat. These are the primary barriers between the internal and external environments of the body. Mucous membranes are coated with secretions that fight microorganisms to defend against infections. They are very selective with what they do and don't allow through. For example, they will allow through nutrients but not bacteria. The digestive tract also contains barriers such as stomach acid, pancreatic enzymes and bile. The pH of the stomach acid is too low for bacteria to survive. The contractions of the intestines and shedding of the cells which line the intestine act to remove the harmful and dead microorganisms. The mucus that coats the airways and nose acts as a filter between the external and internal environments to stop pathogens getting through. Microorganisms get stuck in the mucus lining of the interior of the nose. These are then removed by blowing the nose or coughing. The removal of mucus also occurs due to the rhythmical movement of cilia, which trap the particles and move them up and away from the lungs. The second line of defence includes the role of inflammation in infections. Injury or infection in the skin will cause an inflammatory response. The primary physical effect is that the blood circulation increases around the area that is infected. The blood vessels in the area dilate, allowing more blood to flow through, resulting in inflammation. The different cells in the area congregate, which adds to the inflammation. There is also an increase in body heat, which can sometimes have an antibiotic effect. The area is painful because the swelling in the surrounding tissue puts pressure on nerve cells. Phagocytosis is the process of engulfing and destroying damaged, defective or invasive cells, including microorganisms and foreign substances. During phagocytosis, macrophages are specialised cells which bind to the item it wants to engulf on the cell surface and draws the item in as it engulfs. Cellular enzymes within the macrophage destroy the ingested item. Neutrophils are another type of cell used in the body's defence system. They are white blood cells which fight against bacteria by moving through blood vessels to the site of infection and engulfing any invading organisms. They also release cytokines to attract more cells to the infection. Cytokines are small proteins which are used to boost the immune system response by signalling the presence of inflammation and attracting more defence cells. Some examples of cytokines are monokines, which are produced by monocytes, lymphokine, which are produced by lymphocytes, and interferons, which are produced as a response to viruses. Pathogen is an infectious agent or microbe that can cause a person to fall ill or trigger an immune response. This includes bacteria, viruses, fungi, and protozoa. An antigen is part of a pathogen which tells the body that it's being attacked and therefore causes an immune response. Acquired immunity must be learned and isn't present at birth. The immune system comes into contact with antigens and when it's exposed to the natural environment. The body learns to fight and attack these antigens and create a memory for that specific antigen. Essentially, acquired or specific immunity is where the immune system tailors its attack to an antigen that the body has previously encountered. Specific immunity is so important for fighting off disease because of its ability to learn, adapt and remember antigens. It is possible to give someone artificial specific immunity. This is to be done either by actively putting the antigen into the body in a vaccine or passively introducing preformed antibodies into the body. Immunoglobulins are proteins produced by plasma cells and lymphocytes. They are essential for targeting infection, recruiting immune cells, neutralising toxins, removing antigens and stimulating cells. There are 5 different types of immunoglobulin, the first being immunoglobulin G. This is able to stimulate a direct attack on any foreign cells. One of the most important aspects of immunoglobulin G is that it can be transferred across the placenta to give protection from the mother to the fetus. This way, the unborn baby has protection from some diseases which it hasn't been exposed to yet. The second type is A. This is involved in cellular defence in places such as the inside of the mouth. A lack of immunoglobulin A can lead to severe infections in the mouth, throat and lungs. Immunoglobulin A is the first one to be synthesised in an antibody response. E is only present in low quantity in a healthy human, but these levels increase when there's an allergic reaction or the presence of parasites. Immunoglobulin D is an uncommon molecule which is believed to act as an antigen receptor on the surface of B cells. However, its true function remains unknown. The uniqueness of each individual antigen allows for the immune system to recognise which cells are self and which are non-self. This ensures that only the non-self cells are attacked and the self cells are not harmed. Non-self antigens, which are similar to those recognised as self antigens, will create a weak immune response, whereas those that are significantly different will create a strong immune response. 2 essential aspects which allow the body to distinguish between the self and non-self antigens are the major histocompatibility complexes 1 and 2, and the human lysocyte antigen gene complex. MHC1 molecules are present on the surface of all nucleated cells. They act as a warning sign for the immune system because if the cell contains foreign proteins, then fragments of the MHC1 are displayed on the cell surface. This allows the body to recognise pathogens and then attack them. MHC2 molecules have a similar role, however, are only present on some cells within the immune system. They work as an extracellular presentation mechanism and allow antigens from extracellular pathogens such as bacteria. The T cells notice the fragments and target any cells expressing these antigens. This varies sensitivity to different antigens, so it shows the complexity of the human immune system. An abnormal immune response caused by repeated exposure to the same antigen is called hypersensitivity. Autoimmune diseases are an example of hypersensitivity because they occur when immune system responses are directed against self-antigens and therefore the body is essentially attacking itself and its healthy cells. Autoimmunity is one of the causes of hypersensitivity in humans. It occurs in response to mechanisms of self-tolerance failing, as explained next. The immune system is capable of producing 10 million different types of cells, each one able to respond to specific foreign antigens. As the immune system is creating clones of different lymphocyte cells, it is also constantly culling the self-reacting cells as they are created. Sometimes this process of ridding the body of self-reacting lymphocytes is incomplete, and this leaves B and T cells which are still able to be activated against self-antigens. These cells or antibodies which they release can then react against self-antigens, causing an autoimmune disease. It's not fully understood as to why self-tolerance fails when it comes towards immune diseases. However, it has been suggested that it's down to a combination of susceptible genes and tissue damage. To explain it further, tissue damage can cause a release of antigens that wouldn't usually be present. This, alongside a genetic vulnerability, could initiate a lymphocyte response and trigger an autoimmune phenotype. This is not known for sure, rather just a suggestion. Transplantation is the transfer of cells, tissues or organs from one person to another. Some common examples are kidney and liver transplants. In a similar way to how the body reacts to foreign cells entering the body, it can also react in a negative way to transplanted organs. The immune system is essentially working as a barrier to keep the foreign agent out. During transplant surgery, the immune system can recognise the antigens on the cells of the organ to be different and identify it as non-self. To reduce the chances of this happening, the antigens present in the organ donor and the recipient's tissue need to be closely matched. This will only ever be an exact match with identical twins. Monoclonal antibodies are a type of protein made in a lab which are used during and after the surgery to bind to and attack T cells and prevent the body from rejecting the organ. There are three types of rejection when it comes to transplantation. The first being hyperactive rejection. This is when the tissue is transplanted and the antigens are unmatched. Acute rejection, which can occur between 1 week and 3 months after transplantation. All recipients have some form of acute rejection, some more a bit severe than others. And chronic rejection is when the immune system damages the tissue or organ over many years. The basis of an autoimmune disease is when the body mistakes healthy cells for diseases or infection. It can affect many parts of the body and cause different complications such as MS, autism and arthritis. There are over 80 different autoimmune diseases, each with similar symptoms. This makes diagnosis of an exact disease difficult. Fatigue, muscle aches and low fever are often the first signs, followed by inflammation causing redness, heat, swelling and pain. Treatment of autoimmune disease depends completely upon the type and severity in each individual. Often doctors prescribe drugs such as corticosteroids to reduce the immune response. There is no cure for autoimmune diseases as of yet. Medication that is used is to just reduce the severity of the symptoms. Medical interventions that are used include hormone replacement therapy, blood transfusion, immunosuppressive medication, anti-inflammatory medication, painkillers and physical therapy. Besides drugs, it is suggested to eat a balanced diet, exercise regularly, get lots of rest, take vitamin supplements, limit sun exposure and decrease stress to help relieve the symptoms. Rheumatoid arthritis is a common example of an autoimmune and inflammatory disease. It is where your immune system attacks healthy cells in your joints by mistake, causing a painful swelling. It usually targets the joints in the hands, wrists and knees. The tissue damage can cause long-lasting chronic pain and swelling. Usually rheumatoid arthritis has flare-ups whereby tissue is very swollen and painful for a period of time. It will often then go down until another flare-up occurs. Signs and symptoms of rheumatoid arthritis include pain, aching, swelling and stiffness of joints, weight loss, fever and weakness. Multiple sclerosis or MS is a condition which affects the spinal cord and brain. It happens when the immune system mistakenly attacks the layer that surrounds and protects the nerve called the myelin sheath. This causes damage on the sheath and the nerves beneath, which slows them down and disrupts the messages that are travelling along the nerves. MS affects people throughout their lives. It is most commonly diagnosed in women in their ages 20s and 30s, however it can develop at any age and in any gender. The main and most obvious symptom of MS is fatigue, difficulty walking, blurred vision, muscle spasms and problems with balance and coordination. In most cases it is possible to treat MS, however it varies so much in individuals it can either be fairly mild or can cause serious disability. The life expectancy for someone with MS is slightly reduced. To treat relapses, steroids are prescribed, and to reduce the number of relapses, disease-modifying therapy is used. It is also important for people with MS to look after their general health. Active immunity is when antibodies are created to a specific disease or illness to create immunity. There are two different types of active immunity, natural and artificially induced. Natural active immunity occurs when exposure to a pathogen causes a disease. The body then begins to develop an immune response to attack the pathogen. B cells create an antibody, which is a protein made to attack and kill pathogens. The B cells have a memory. They remember the antibody to provide long-term immunity against the specific pathogen in case it were to enter the body again. Artificially induced active immunity is where an individual is intentionally exposed to a foreign antigen to encourage the immune system to create antibodies. The antigens are put into the bloodstream by a vaccine. They then cause a reaction in the immune system which stimulates the production of antibodies and memory cells. The process is very similar to natural immunity once the antigens have been injected. There are also two different types of passive immunity, natural and artificially induced. Natural passive immunity is when antibodies are passed from one person to another, often from mother to unborn child. In pregnancy, antibodies can be transferred from the mother's bloodstream to the fetal blood, giving the baby immunity for its first few months of life. The immune system doesn't reach full maturity until around 5 years of age. Artificially induced passive immunity is where antibodies created by someone else are given via injection. These antibodies work in the same way and neutralise the pathogens. This protection only lasts a few weeks because they are not naturally replaced as they break down. There is no involvement of the person's immune system. Vaccination is given to purposely expose the immune system to a weak version of a pathogen to stimulate white blood cells to begin producing antibodies, which will in turn provide immunity against a specific pathogen. Live vaccines only contain weak versions of the pathogen in a small amount so that the person doesn't develop the actual disease. Some people may suffer mild side effects as the immune system strengthens its response, however, it won't be anything too serious. If the person comes into contact with the pathogen at a later date, the white blood cells are able to reproduce the antibodies quickly and destroy it. This is an example of immunological memory. To define immunological memory, it is the ability of the immune system to respond more rapidly and effectively to pathogens that have been encountered previously. Inactivated vaccines are vaccines produced by growing the bacteria or virus in a culture media and then inactivating it with heat or chemicals. These are therefore dead and can't replicate. They often require more than one dose because the first dose doesn't usually give immunity but only primes the immune system ready for the next dose. After the second or third dose, immunological memory is gained, and therefore next time the pathogen is encountered, the immune system will respond straight away. The main benefit of vaccines is that they protect us from serious diseases that we haven't naturally got immunity to. Immunising people has helped some diseases be completely eradicated. Worldwide immunisation programmes meant that smallpox were eradicated in 1979 and Europe has been polio-free since 2002. Childhood deaths were much more common before the introduction of routine immunisations. Diseases such as measles, polio and whooping cough are some of those that children are vaccinated against. Although they do still exist, the chance of children being seriously ill with complications is reduced massively after having the vaccination. More benefits include that the NHS don't have to treat the diseases. The cost of treating the diseases is much higher than the cost of the vaccine. It reduces antibiotic resistance because they are used to treat less things, and they extend life expectancy, prevent cancer, and improves economic growth because less people are unwell. These benefits are supported by data recorded about measles infections rates from 1940 onwards. In 1940 there was 857 deaths from measles, 1941 even higher at 1,145. These numbers then fluctuated between roughly 50 and 750 over the years up until the MMR vaccine was introduced in 1968. At this point the numbers dropped dramatically to 51 and then onwards remained under 50. Over time, as the vaccine has been given to more and more people, newborns included, the numbers of deaths from measles has continued to drop, with only 26 deaths in 1980, dropping to just 1 in 1990, 1 in 2000 and none in 2010. Public Health England have estimated that 20 million measles cases and 4,500 deaths have been avoided in the UK because of the vaccine. This data gives evidence that the vaccination programme has prevented millions of people from getting measles, many infant deaths, and saved a lot of healthcare resources and money treating people with it. Contagious disease can spread from one person to another through different modes of transmission. Vaccines are essential to stop this spread because they create a herd immunity. Herd immunity is when the majority of the population are vaccinated against a certain disease, leaving very few who can become infected. It is massively important with this to protect people who are unable to have the vaccine or who have weak immune systems. A successful example of herd immunity is the eradication of smallpox by mass vaccination. Some problems with gaining herd immunity is that sometimes people don't want the vaccines because of religious reasons or because of the potential side effects. It is possible for people to become infected before the vaccine has time to work. Some people have compromised the immune systems and therefore might not be able to produce an immune response. There are hundreds of different variants of pathogens which all present different antigens, and pathogens can mutate very quickly, meaning that regular boosters with different variants are needed. To calculate a threshold percentage for individuals that should be vaccinated to provide herd immunity, a basic reproduction number for each individual disease is calculated. The basic reproduction number is how many people in an unprotected population could catch the disease from one infected person. The reproduction number for measles is between 12 and 18, and for polio between 5 and 7. The higher this number, the higher the immunity threshold must be in order to create herd immunity. The immunity threshold needed to protect a population from measles is 94%, and for polio is between 80 and 86%. There are NHS vaccination programmes which go ahead annually to give certain adults, including the elderly, asthmatics and pregnant women, the influenza vaccine. To encourage people to have the flu jab, many pharmacies have been giving them to make it easier for people to attend at convenient times. In addition to vaccination clinics, to make routine vaccinations for children easier and less scary, they are given in schools by health visitors and nurses. This encourages children to have them as all their friends are having them too. There are many different vaccines that children are given, including the 6-in-1 vaccine at 8, 12 and 16 weeks of age, the MMR given at 1 and 3 years old, HPV for girls at age 12 to 13, which is 2 doses, and there are many more. Before having a vaccine, the safety of it is a major factor that people, including parents giving consent for their child, need to consider. For example, recently there have been a number of suggestions that links between the MMR vaccine and the development of autism. However, there is no doubt that the vaccines are essential for preventing serious and sometimes deadly diseases. The suggested link between the MMR vaccine and autism has meant that there have been a huge decline in the number of parents allowing their children to be given the MMR vaccine. Although the link has been proved false since, the effects are still the same. Aside from the obvious that people don't want it due to the possible side effects, another factor that affects vaccine uptake is that people who are already recovering from another illness aren't given it. There are also some groups of people who believe that vaccines do more harm than good and refuse to have them. These are called anti-vaxxers. They believe that vaccines cause things like cancer and they avoid having them at all costs. Luckily, this is a minority, and so herd immunity can still be gained.